Thyroid nodules are growths of abnormal tissue in the thyroid gland here at the base of the front of your neck. Most of the time, they are benign or not cancerous, although a very small percentage of them would be cancerous and would require further evaluation and workup. Thyroid nodules are more prominent in women, and about half of people above 60 years old will have them. Most of the time, thyroid nodules don't cause any symptoms. However, when they become big enough, they may cause a sensation of fullness in the neck or the throat, difficulty with swallowing. Might be something you notice when you're trying to clasp a necklace or button a shirt. For benign thyroid nodules causing symptoms, there are a few different options for treatment. The first would be medicine to suppress the function of the thyroid. Another option would be surgery to remove the nodule or part of the thyroid or the entire thyroid gland. Or what we offer here, a minimally invasive option, which is thyroid nodule ablation. Thyroidectomy, or surgical removal of the thyroid, either partial or the entire gland, can be an effective treatment for thyroid nodules, but it comes with a few drawbacks. It would require general anesthesia, a large scar across the neck, risk of infection, bleeding, damage to the vocal cords. And in some cases, if the whole gland is removed, the patient would be required to take thyroid hormone for the rest of their life. Thyroid nodule ablation is a minimally invasive procedure to shrink thyroid nodules. We use an ultrasound machine to guide a small needle into the thyroid nodule. It's hooked to energy. It produces heat to destroy the nodule tissue, which causes shrinkage and alleviates symptoms. It is a safe and effective alternative to surgery. Thyroid nodule ablation is performed right here at North Star in the office. It's about 2 hours of your day to come visit us. It can be done successfully without sedation, although we would offer it for those that would want it. You come into our ultrasound room, we have you lay flat on the table. We would use an ultrasound machine to guide the ablation probe, which is a thin needle into the thyroid nodule. Patients can expect minimal discomfort during thyroid nodule ablation, as it's most often performed under local anesthesia only. The procedure typically takes 30 to 60 minutes, depending on the size or the number of nodules being treated. All of our patients go home the same day and can resume normal activities in a day or two. Thyroid nodule ablation is less invasive than thyroidectomy and carries fewer risks. Possible side effects from ablation are swelling, bruising, or treatment site discomfort. Compared to thyroidectomy, we don't have the risks associated with general anesthesia. There is no surgical incision, and we preserve the thyroid's function, so we eliminate the need for lifelong hormone replacement therapy. In rare occasions, ablation can cause irritation of the nerves that supply the vocal cords and cause hoarseness. It happens in about 1% of cases. The majority of the time, the hoarseness clears within minutes to days. Recovery from thyroid nodule ablation is typically quick. There may be some mild soreness or swelling at the site, and patients can return to normal activities immediately. After thyroid nodule ablation, patients can expect the treated thyroid nodule to gradually shrink and reduce in size. As far as symptoms of discomfort with swallowing or fullness in the neck, those can go away as soon as 2 weeks after the procedure. And then we would like to follow up with patients with ultrasound to determine the efficacy of the procedure and monitor the size of the nodule as it shrinks over the first year. The success of the procedure depends on the size or the number of nodules or where they're located in the thyroid, but overall, thyroid nodule ablation is a safe and effective alternative to surgery.